Hi, I'm Dr. Busti, and I appreciate you giving me the opportunity to briefly share why I developed This Is Why, my unique background, and more importantly, what credibility I have that makes you want to listen to the topics that I teach on. As one medical professional to another, including those of you in training to become one, I know the journey you're on. I've walked it myself for the past 30 years. I also know how overwhelming it can feel to not only keep up with the information, but also to truly understand it in a way that makes sense at the bedside with your patients. You know, one of the things that I've seen over and over again, whether I was a student, a clinician, or faculty, is that we're often taught what to do and how to do it, but not always why we are doing it. Unfortunately, when that happens, it can create gaps. So sometimes we go through the motions, assuming that we know enough, until we're challenged to look at it from a different angle. And then suddenly the light bulb goes off. Oh, that's why we do this. I can't tell you how rewarding it is when that happens to a student, a resident, or a colleague, when the dots connect and suddenly medicine isn't just information anymore, it's understanding. Furthermore, when that understanding translates to a real patient encounter and the right decisions are made, that's when it becomes life-changing. That's why I built This Is Why, to share the insights, to help you connect the dots and understand the why so that you can master the how. So who am I and why should you listen to me? Well, my background is somewhat unique. I started my career as a nurse. I got my RN BSN. I worked in the surgical trauma ICU and then moved to the emergency department. I then became a pharmacist and got my PharmD at Texas Tech University Health Science Center and then did a pharmacy residency at the University of Texas at Austin. At that point, I then held faculty positions in both pharmacy and nursing, while also maintaining an active outpatient and inpatient clinical practice and research program in Dallas, Texas. After 8 years, I went back to become a physician. I got my MD at Texas A&M College of Medicine and then did a 4-year emergency medicine residency at Johns Hopkins School of Medicine in Baltimore. It was at that point I took a faculty position at University of Texas Southwestern Medical Center in Dallas and completed a master's degree in evidence-based healthcare at Oxford University in the UK. But from the beginning, I've been on the front lines caring for patients while also helping the next generation get ready to do the same. And that is still true today. Those experiences have given me a 360-degree view of nursing, pharmacy, medicine, education, and the ongoing evolution of evidence that continues to guide our clinical decisions. I have seen firsthand how easy it is to miss the why in our training and how powerful it becomes when we don't. When medical professionals fully understand the reasons behind their actions, they practice with more confidence, greater precision, and ultimately deliver better care for their patients. At the end of the day, we all went into healthcare for similar reasons: to serve, to help, and impact patients at some of their most vulnerable moments and times of need. That's a sacred level of trust. And I believe the best way to honor that trust is by never settling for just knowing what, but instead we challenge ourselves to understand the why, because that changes everything about the how. That is the heart behind This Is Why. My hope is that as you explore what we are building here, you find tools, clarity, and insight that makes you better at what you do and deepens the impact that you can have on your patients. Because when you understand why, you don't just practice medicine, you begin to transform it. Thank you for letting me share a bit of my story, and I look forward to walking this journey with you.